What's going on, people? Welcome to Food Chest. Hope you're doing well. Top of the day to you. Let's get right into it. All right, so I'm going to start with a question. And that question is, what can Africa learn from America's ongoing investigation into the COVID-19 response? Um, if you're not aware, there has been a lot of congressional hearing pertinent to COVID-19, and Dr. Fauci has been pleading the fifth like 1,000 times. So it just got me thinking, I'm like, this is weird. And it just, as we know, this channel is all about Africa. It just got me thinking, so what is going on what is going on in Africa? What are African leaders doing? Are they listening to this hearing? And are they asking questions? But before I proceed further, let's talk about this a little bit. And I'm going to kind of explain the angle I want to proceed on. Now, we're hearing a lot of scrutiny on Dr. Fauci, including congressional questions about pandemic decision making. The communication that was done during the time, research funding, and how scientific uncertainty was communicated to the public. And again, while I'm not going to focus a lot on politics of it, party alliance, and all that stuff, I'm more interested in the bigger question, which is pertinent to this channel. And that question is, what did COVID-19 reveal about Africa's dependence on the rest of the world for vaccines, pharmaceutical products, scientific research, and public health expertise? And that's where I want to take this conversation to, basically, right? That's the angle I want to focus on. Now, as we all know this, Dr. Fauci became one of the most recognizable faces for America's COVID-19 response. Now, years later, congressional investigations are still examining decisions made during that time, including questions about the communication and the modes of communication that were used, research, the funding, the origin of COVID-19, and how information was presented to the public. The important thing here is to separate what has been proven from what is still being investigated, right? And that's exactly how I'm going to approach the conversation. Now, what does this investigation actually mean? The investigation doesn't automatically prove that, the doctor is wrong or he's right about everything that happened. But however, there are questions. It raises the questions of what officials knew, when they knew it, how scientific uncertainty was handled, how government communicated changing evidence, how research funding was used or overseen, and whether the public received complete information. Now, all of these are legitimate questions, but here is where I want to shift the conversation. And this is the area, like I mentioned, I want to focus on, right? Instead of spending the time on like Fauci, I don't want to do that, right? What I want to do is talk about Africa. So let's do that real quick. And that's the bigger question. Now, COVID taught everyone in the world something important, and I hope it taught the continent of Africa an important thing as well. The thing that COVID taught us is that during a global crisis, the countries that control the science, technology, manufacturing, and supply chains have enormous power. Africa discovered that it did not control enough of those things. De facto. Now that brings me to another question. Again, what happens when Africa needs medicine or vaccines, but Africa doesn't manufacture enough of it? What happens? And why does this matter for Africa? So let's look at this during the pandemic, right? So during the pandemic, we know that African countries had to compete for vaccines. They had to compete for medical supplies, for technology, and expertise, while wealthier countries were often able to secure supplies first. So the conversation isn't simply about vaccines right now, right? And again, going back to what did COVID teach us? So it taught us that it's not just about medicine and vaccines. It's about health sovereignty. That's the main thing. It's about independence. And that's always the question. Is Africa really independent? These are the questions. Can Africa produce what it needs by itself? Can Africa conduct its own research? Can African scientists independently evaluate global health recommendations? Can African countries manufacture vaccines and essential medicines during the next crisis? Because if the answer is no, which it is a no, right? Then COVID wasn't simply a health crisis, it was a warning for African countries, especially. And that's where I want to focus the rest of this conversation. And guys, hang around with me. We're going to have this discussion. Now, Africa's vaccine independence, right? It was revealed during COVID. During COVID, Africa faced fundamental problems. Africa did not control enough of its own vaccine supply. In 2021, for example, only about 1% of the COVID vaccines were manufactured locally in Africa, leaving the continent heavily dependent on imports. Let's think about that for a moment. A continent of more than 1 billion people with some of the world's fastest growing population had very limited capacity to manufacture the vaccines needed during a global pandemic. That's not a medical problem. That's a sovereignty problem, like I mentioned earlier. That's a dependence problem. That's a you're not really independent problem. So when a crisis happens, the countries that control manufacturing, the capacity to manufacture, have options. Countries that don't have that capacity to wait. They don't have the capacity. They have to wait. And during COVID, Africa often was left waiting. There wasn't anything like vaccine equity for African countries. For example, the COVAX initiative was created to help distribute vaccines more equitably, and African countries participated heavily in the program, but access remained unequal. And this is where I think enough more and more sophisticated conversations need to be had about vaccine hesitancy in Africa as well. Because often what we heard during the time was that Africans didn't trust the vaccines. Sometimes that was true, but that's just not the whole story, right? We shouldn't just assume that the hesitancy, was the only problem. Think about the circumstances that faces African population and the country and the continent as a whole. Is that if you don't know when vaccines are arriving, if you don't know where you're supposed to get vaccinated, if information isn't available in your language, if you don't trust your government, if you historically had limited access to quality healthcare, the vaccine hesitancy is not just Africans are questioning, or it's not just an ignorance thing. It's a question of trust, access, history, and institution. So Africa's COVID experience, it has to be examined from both sides, right? Did the government communicate properly? Or did African populations have legitimate reasons to question the information they were receiving? These are difficult questions, of course, but we need to ask them. Just as what is going on in the US is happening, Africa needs to be asking these questions. Also, who controls the science is another, major thing that African countries, have to look into post-COVID. Imagine you're a health minister in an African country during the pandemic. You receive guidance from the World Health Organization. You receive information from the US, information from Europe, information from China, even information from India. You have pharmaceutical companies trying to sell you products. And then you have your own population asking questions. What should we believe, or what should they believe, right? In this situation, what do? If the country doesn't have strong scientific institutions, labs, research, and all that stuff, you're going to be dependent on somebody else's information, analysis, medicine, drugs, etc., etc. And that's dangerous, right? And again, the thing is that I'm not trying to say African countries should ignore, World Health Organization and stuff like that. I'm arguing the opposite. Africa should have enough scientific capacity to engage with the WHO as an equal partner Africa is too big. It's too rich for all this nonsense. Or for dependence. Africa needs to engage with these countries. That is where Africa should be, right? Africa should have enough scientific capacity to engage with the World Health Organization. African scientists should be able to look at data and say, this recommendation is good for us, or this recommendation is not good for us. It should be able to say, contextually, this is what we should do, this is what we shouldn't do. It should not be, oh yes, bring, and begging. That shouldn't be the case. And Africa needs to also be able to manufacture its own medicines, right? Because it's not just, and we know that, yes, you can tell me that, oh, we've been talking about this for such a long time, which is true, but we have to keep saying it. And we have to involve the medical practitioners in diaspora and all whatnot, because this is a serious issue here. So Africa needs to manufacture its own medicine because it creates a lot of things. Scientific expertise, jobs, research capacity, supply chain resilience, technology transfer, intellectual capacity, emergency preparedness, like COVID. So let me give you a scenario here. Imagine in Africa, for example, where Nigeria, South Africa, Kenya, Ghana, Senegal, Rwanda, and other countries, just to name a few, have strong pharmaceutical and biotechnological labs or industries. Imagine where the universities cooperate with pharmaceutical companies in Africa. Imagine African governments maintaining strategic medical reserves. It changes the question. Africa goes from being primarily a consumer of medical technology and becoming a producer itself, which is important. I mean, this was the case in South Africa. If you remember, during COVID, Myrna, which is mRNA, they had a hub in Cape Town, right? And the goal was to help, with the hub, I believe the goal at that time was to help build the technical capacity necessary for countries to develop and manufacture its own mRNA vaccines. That was the goal at that time, which was reported. Now, this kind of initiative is fine, right? But the challenge is always technology transfer cannot only be simply meaning building like a hub, which they did, and then the problem is solved. No, Africa needs to have an ecosystem. It's important to have an ecosystem, right? What is an ecosystem and what does it look like? It means having universities, research institutions, pharmaceutical companies, manufacturing facilities, investment capital, clinical trial infrastructure, and skilled workers. That's what it means, right? And all this leads to what? Health sovereignty. But again, health sovereignty doesn't mean isolation. And I want to make that clear, right? Health sovereignty doesn't mean that, because some people think that when you say African health sovereignty, it means that Africans shouldn't cooperate with other people. No, it's actually the opposite. Because no country can do anything by itself, right? So the United States cooperates with other countries, Europe does, China does, and Africa needs to do the same, right? The difference between the two is that partnership is different from dependence. So if you're dependent, like Africa is, which was showed by COVID, you have limited choices. If you're capable, you can negotiate. Africa should be able to say, we want to work with you, to anybody in the world, but we also have our own scientists, we have our own manufacturers, and our own researchers, and our own institutions. And that should be the anchor for any final say. And that's a much stronger negotiation position. That is what Africa should seek for. And also, I talked about trust earlier on, because trust is a public health asset. Trust takes a long time to be built, but it takes a second to be destroyed. So there needs to be clear communication and there needs to be trust. Public health institutions must be transparent enough, for citizens so that citizens can understand and know what's happening. That wasn't really prevalent, and that's one of the issues arising now. Okay, so in order to do everything I'm talking about, being health sovereignty and all that stuff, Africa needs better health data as well. And we don't talk about this enough. So you cannot make good public health decisions without good health data. Africa needs stronger systems for genomic sequencing, for example, which is not there, disease surveillance, vaccine monitoring, hospital capacity, and a lot more. Why is this important? Because if a new virus appears, if a new pandemic appears, say in Lagos, in Johannesburg, in Nairobi, in Accra, in any other African country, African governments needs to know, they need to know quickly what is happening, how quickly it's happening, how quickly it's spreading, what is causing it, what are the vulnerability circumstances, the vaccines that are working, the vaccines that are not working, and the side effects. And African scientists needs to be able to, that's why there needs to be development of scientists within the continent, right? Not repeating the same mistake is another thing, right? A new virus can appear anytime. It can appear anytime. When it appears, the United States will begin developing vaccines. Europe will follow suit. China will follow suit. India will follow suit. Maybe other countries will follow suit. Then what would Africa begin to do? Africa will begin to ask, when are we going to receive ours? That's unacceptable. And that should not be the plan. Africa should already have manufacturing capacity, emergency stockpiles, strong regulations, and things to be able to also begin developing its own vaccines if another pandemic breaks out. Right? So these are the things that the whole congressional hearing is exposing. And these are the ways Africa needs to become prepared for the next thing. So in a more concrete manner, and from what I've seen and what I've said so far, what should Africa do? Now, let me tell you something. Like, I know everyone is like, oh, COVID is over. It's done. That's true. But a country that cares about its people sees what happened and begins to act. So if you're watching, you're an African health minister, this is what can start happening. Africa needs to invest in pharmaceutical manufacturing. It's highly important. Build African research institutions, strengthen regulatory agencies within the continent, build regional cooperation, and build public trust. Within these 5 points, there are other points in it, but these are the main things that African countries need to do. And, one thing is that if you come to the diaspora, African medical doctors, pharmacists, chemists, if you want to say, even in Canada, one of the leaders in the health ministry is a Nigerian Igbo woman. Shout out to her. So outside of Africa, Africans are doing great things in the health sphere. So therefore, it behooves African leaders to involve African health professionals in the diaspora. Scientists, doctors, engineers, researchers, and entrepreneurs working within the health sector. Africa needs to create a mechanism for these people to contribute, not just send money and send donations, but through knowledge transfers, investments, research partnerships, and entrepreneurships. Imagine connecting African researchers to Boston, London, Toronto, Paris, and Washington with institutions in Lagos, Accra, Kigali, Nairobi, Cape Town, etc., to create a powerful scientific network. This will be life-changing. Africa can do it. The money is there, the resources are there. But again, why don't Africa, why don't they do it? That's the question. This is way more than COVID, right? It's more than COVID. Because COVID, like I mentioned, eventually becomes history. But the structural problems COVID exposed aren't going away. Africa still imports enormous amounts of medical products. Africa still faces health worker shortages. Africa still has gaps in, research infrastructure. Africa still struggles with pharmaceuticals, manufacturing capacity, and Africa still needs stronger health systems. So the question isn't what was right or what does Fauci say that was right. The bigger question is, what did Africa learn? Again, the question here is not was Fauci right or what. The question is that what did Africa learn from the COVID pandemic and from the congressional hearing and the questioning and the investigations going on currently here in the US? What is Africa? Is Africa talking about this? What did Africa learn? So here are the biggest takeaways from COVID. Africa should listen to the world, right? It's important. Cooperation. Nobody's saying Africa shouldn't listen. It's important to listen. Cooperation is pertinent, is necessary. But Africa must develop the ability to think for itself. It's high time. It's high time. If the World Health Organization gives recommendations, African scientists should be able to evaluate it. If Pfizer, if Moderna says develops vaccines, African regulators should evaluate the vaccines. If the United States government releases guidance, African governments should evaluate the guidance. If China provides medical technology, African governments should evaluate the technology. So the answer shouldn't be America said it, it's true. Europe said it, it's true. Or China said it is true. Or anybody said it is true. Or the World Health Organization said it is true. The answer should be, what does the evidence say? That is what, and for you to do this, Africa needs to be medically, healthily sovereign. And to do this, Africa needs the institutional capability in order to answer these questions. So, to bring everything back, right? Dr. Fauci, the investigation is going to continue. More documents are probably going to come out. I heard about the diary that he was keeping and the whole thing with, China and all that stuff. And more questions are going to be answered, or the fifth is going to continue being pleaded. And perhaps some of the conclusions that people have drawn about COVID will change, right? But regardless of where the investigation ultimately lands, Africa should take a lesson from the entire experience. The next pandemic is not going to ask whether Africa is ready or not. It's simply going to just come. It's going to knock on your door, knock on the continent. And when it does, Africa shouldn't have to wait for somebody else to manufacture the vaccines. It shouldn't have to wait for somebody else to conduct research. It shouldn't have to wait for somebody else to interpret the data. It shouldn't have to wait for somebody else to tell it what to do. Africa needs the scientific capacity, manufacturing capacity, and institutional capacity to make its own decisions. That's what health sovereignty means. That's what independence means. It doesn't mean isolation. It doesn't mean rejection of Western medicine. It doesn't mean rejection of vaccines. It means having the capacity to participate in the conversation as an equal. Because the ultimate lesson of COVID shouldn't be don't trust this person, don't trust this person, or trust this person. It should be build institutions worthy of trust for Africa. And for Africa, specifically, it means building the capacity to protect African lives with African science, African institutions, and African expertise, while continuing to cooperate with other countries is important. Cooperation is important. Cooperate with the rest of the world, but have your own. Because partnership is good, like I've mentioned. Dependence is dangerous. And Africa is depending too much. It did during COVID. And the next pandemic could be the test. I know everybody wants to know the pandemic is done, but who knows? Who knows? Another lab might come up with something. And that could be the test for Africa. So what do you guys think? What do you think? Should African governments make pharmaceutical and vaccine manufacturing a national security priority? Should Africa invest more and heavily in biotechnology and medical research? And do you believe African countries have learned enough from COVID to be better prepared for the next pandemic? Let me know, guys. Let me know in the comment section. Let me know what you think. For real, let me know what you think. And if you enjoyed this, guys, comment, subscribe, share, and let's keep the conversation going. Once again, man, this is Food Chest. See you guys next time.